All right, everyone, and welcome to the appendicular skeleton. So let's talk about all of the bones that aren't in your axial skeleton. So for this presentation, I am going to be using mostly images from your textbook because they are pretty decent for the appendicular skeleton. I did like going for outside sources for the axial, but we're going to roll with it except for the hip for the appendicular skeleton. So again, the axial skeleton here is in green, which is again the skull, your cranium, your mandible, which is your jawbone, your cervical vertebrae, your sternum, your rib cage, your thoracic vertebrae, your lumbar vertebrae, your sacrum, and your coccyx. Now we're going to study everything else. This includes your shoulder girdle, which is your clavicle and your shoulder blade, your pelvic girdle, which are your pelvic bones, your arms, your hands, your legs, and your feet, and everything that entails. So the first thing that we are going to cover is the clavicle, also called the collarbone. Now, this is the image out of your book by itself, so I have included our handy dandy skeleton helper here so that we can see exactly where these bones are located. This is the clavicle. You have one on each side of your body. Now, the image here is showing this is the sternal end, and that is going to go by the sternum. So we are looking at this model's left collarbone. Remember, this might be your right side looking at the screen, but it is your client's left collarbone. All right, this is the acromial end. It attaches by the acromion, but we'll cover that in a little bit. So this is the sternal end by the sternum and the acromial end. This is the lateral end. This is the medial end. Medial, lateral. All right. This next one is the scapula or the shoulder blade, which is an irregular triangle bone with a flat anterior surface. So this is anterior. It is facing the front of the body. The posterior shoulder blade has very interesting features. This is this scapula right here. Okay, so we are discussing your client's right scapula. This is the posterior view. This is the anterior view. All right. The posterior surface has a large spine and two major processes that are super easy to palpate. So this is the scapular spine right here. And the names on the scapula are pretty easy to follow once you get used to all of the anatomical naming conventions, okay? This is the superior angle. It is superior. It is up top. Superior is up, inferior is below, right? Supra is above, sub is below, superior is above, inferior is below. This is the superior angle of the scapula. This is the supra, above, spinous, above the spine, fossa. It's an indention in it. So that's what a fossa is, but it is above the scapular spine. So it's supraspinous fossa. This is the infra, below spinous fossa. It's another indention below the scapular spine. This is another angle. It's called the inferior angle. It's going down. Superior angle is up. The inferior angle is down. And this is where that translates to on this model body. This is the acromion. This is where your clavicle articulates to and can get jammed into if you fall and get injured. Very often, if the clavicle doesn't break, it will snap off here from its connection. This is the suprascapular notch. It's above it. It is a notch. Supra, above, scapular. It is on the top of the scapula. The infra, below, glenoid, tubercle. All right, we're talking about the tubercle here. This is the glenoid fossa. We're looking at this right here. It is where it articulates to the head of the humerus. This is the coracoid process. And the acromion in here is just the acromion. I have heard it referred to as the acromion process a couple of times on the MBLEX. So just be aware of that. It is acromion here, but it could be acromion process, just like this is coracoid process. This is the supra, above, glenoid tubercle here. So we have one above and we have one below. This is the medial border of your scapula, and this is the lateral border. Now remember, this is facing interior. This is facing the front of the body. So this would be the outside, or excuse me, the inside, and this would be the outside. Look at how it's shaped here, this long straight edge, just like this. This is on the medial edge, and then we have the short curved edge is on the lateral edge. Now, when people move their arms, when they protract, remember protraction, when we protract our shoulder blades, we are moving this outwards. We can pull it up and forward, and we can also pull it down when we do elevation. This will elevate, this will turn up. If this depresses, this will turn out, and you'll have this little sharp point coming out that you can palpate quite easily. One tip for your future clinic days and your career as a massage therapist, if you have your client bend their arm so that their hand rests on the small of their back, it will naturally lift the scapula, and you can get to quite a bit of the soft tissue right here on this medial edge. It will help lift and separate that tissue for you to get in there nice and deep. All right, moving on. This is our lovely model and their posterior side. All right, and here we have an anterior and posterior view of the humerus. Here you see the greater tubercle and the lesser tubercle. This is called the deltoid tuberosity. This is the radial fossa. This is the lateral epicondyle. So we know it's going to be where? On the outside. Okay. It's going to be on the outside of the arm. Right over here is what we're looking at. There is the capitulum. There is the trochlea. This is where the bones of the forearm articulate with it. There is the coronoid fossa. This is an indention right in here. It's almost like a thumb pad sized groove. This is the medial epicondyle, right? That thing almost looks like a little snubbed thumb sticking out. Look how big that looks over here. That is the medial epicondyle. And this is the head of the humerus. This is the head of the humerus that articulates right here into that fossa that is in your scapula. Now, your forearm, which comes before your arm, your humerus, all right? We've looked at the clavicle up here. We've looked at the scapula. We've looked at the humerus and its tubercles. Now we're going to look at the two bones that make up the radius and the ulna. I'm just going to jump back to the humerus so you can see down here that we have the radius and the ulna. This is called the radial fossa. It is on the side of the radius. All right. The olecranon process of the ulna. It comes out right here and it sort of rolls up and over. When you go into flexion, it becomes a big point and it sort of tucks in a little bit better when you go into extension, like this model is currently doing. The olecranon process, that is your elbow point. That is your funny bone. Here's your trochlear notch. And here's your coronoid process. This is your ulna. This is your ulna. When you are standing in anatomical position, it is medial to the body. It is on the side of your pinky finger. Your radius is on the lateral side of your body when in anatomical position. And it is on the lateral side of your body by your thumb. All right. This is the radial head. This is the radial tuberosity. And it acts as a little hinge right there onto the ulna. The radius. This is the radial styloid. This is the ulnar styloid. All right. These are the major parts of the bone that you need to learn. Now, what is this? The interosseous, between bone. Remember, osseous is bone, between bone membrane. So interosseous just means between bone. This is the between the bone membrane that is help keeping these sort of stuck and moving together. It is a fascial sheath that spreads across like a little sheet of super thick saran wrap. And there are little openings in here for various nerves and fibers to get through. Now let's look at the arm as a whole, including the shoulder girdle. So here we're looking at it from a posterior view. Okay, remember the shoulder blade, the scapula is way more interesting from the back. That is where the scapular spine is. Remember, this is the scapular spine. All right. And here are your processes. This is the head of the humerus, where it goes into that glenoid fossa right here. This is where it articulates into the scapula. Your clavicle wraps around the front of your body there. That's your collarbone jutting out from in front of your neck up front. And here we have the humerus. This is the humerus. See how it spreads out in the posterior view to sort of cup around the radius and the ulna. And the ulna bulges upward and has this point, this process. That's what we call a point on a bone very often is a process. So you're looking at the olecranon process in this case, which is your elbow. This is the point of your elbow, your funny bone. This is the medial epicondyle of the humerus. Remember, it's this big boy sticking out here on the medial side. And you also have a lateral epicondyle. It's not quite as large. The ulna is on the side of your pinky finger. All right. And your radius is on the side of your thumb. This is an anterior view here. This is your clavicle swooping out to the front. This is the smooth portion of your scapula here. It is like that for smooth flowing over your rib cage and all of the tissues between so that it's able to glide. It doesn't have all these notches and fossas and spines for a variety of those big thick back muscles to attach to, because on this side we want to be nice and smooth for gliding over the back. Here's the greater tubercle of the humerus and the lesser tubercle. Again, this is the head of the humerus, even though it's not labeled. And see how it's rotating nicely right inside of the fossa of your scapula. Okay, here's your coracoid process. You can see I sort of marked it right over here. You can see it from the other side. Here it is right there. You can palpate these bony protuberances quite well. Again, on the interior of the elbow. So when you are extending your arm in anatomical position, this is what we call the inside of the elbow. Here's the capitulum. This is on the lateral side. The trochlea is on the medial side. Okay, so this would be the trochlea over here. This is the capitulum over here. Here's your radial tuberosity. This is an attachment point for some of your big muscles. This is your radius. It's going on the thumb side. Your radius is over here, lateral. Your ulna goes by your pinky. It is over here. It is medial. Hello and welcome to your hands. All right. So we're obviously also going to talk about the wrist joint. It's the joint between the hand and the forearm. And the structure of the wrist allows all of the movement of the hand. Now, the hand itself has 27 bones. The carpus, or what we call the wrist, accounts for 8 of those. The metacarpals of the palm account for 5 of those. And the remaining 14 are digital bones, fingers, and your thumb. Okay, in the palm of the hand are the 5 metacarpal bones, and those are the long bones that form the framework of each hand. These are your metacarpals right here. Okay, so this is your hand. Your fingers don't start until here, which means that the knuckles, your big knuckles when you close a fist, they're the rounded distal ends of your 5 metacarpals. These are your knuckles right here. They're the rounded distal ends of your metacarpals. Now, your finger bones are called phalanges. And when we talk about which phalange, we use proximal, closest to the body, middle, and distal. These are your fingertips. They are the most distant from the hand. They are distal. They are the furthest distance from the hand. They are distal. Your thumb, of course, only has 2, so it is proximal and distal. All right. Your carpal bones are all labeled here for your enjoyment. I don't know that you necessarily have to memorize all of them all the time. But as soon as I tell you that, I'm sure you'll have a carpal bone question on the MBLEX and I will feel terrible. So here they are. They are the trapezoid. There is a tubercle of the trapezium. The trapezium is this one here, closest to your thumb. You also have a tubercle of your scaphoid. This is your scaphoid. It actually looks like some scaffolding right here. This is the articulation of your wrist joint here. And of course, this is your radius. Remember, it's by your thumb, so it's your radius. This is your ulna. The one that is sort of in between the scaphoid and the next one over your ulna, this little medial one here, is called your lunate. The tricutrum. Thank you. Hello. It's been a long day. I apologize. Your tricutrum is right in here, and it's pretty cool. It looks like it has 3 sides like a triangle. It's literally shaped in this triangle shaped around the pisiform. So it is the tricutrum. I don't know why I'm tripping over that word tonight. Tri as in 3, cutrum. Your pisiform is right here. It is hanging on desperately with this ligament. Your hamate looks like a big hammerhead. This is your hamate. It's one of your larger carpal bones. And there is the hook of the hamate here. And here is the capitate. This is sort of like your capitis, the top of your head. It is the uppermost carpal bone that sticks out. And we're back over to this side here by the thumb, and this is the trapezoid. All right, these can get out of place fairly easily. They can be snapped back into place. Please be aware that there is an arch to this. All right. This is curved. This is not actually flat. There is an arch that is in here, and they show you the shape right here because you have a ton of nerves and blood flow coming through here, muscle fibers, various tendons and ligaments running through here. This is also where the famous median nerve lives that likes to get inflamed. And then you get to hear a lot about carpal tunnel syndrome as we move on to pathology and issues in the body systems later on. So this little area is also covered with what we call an aponeurosis. It's another little fascial sheath that comes in right here that forms the other side of your wrist. So that's where you get this circular shape of your arm, is between this carpal arch here in your wrist and then this aponeurosis, and of course your tissues running in through it, sort of bulging it upwards. And this entire area is just absolutely packed with nerves and blood vessels. So please be aware this is a flat 2D image, but your hand is actually very curved. So we are going to move further down the body now. We have covered everything in the upper body: the shoulder girdle, the humerus, the ulna, the radius, the carpal bones, the metacarpals, and the phalanges of the hand, all 27 bones. Now we're going to move on to the hip. I'm just going to look at this image with you briefly and say, this lateral view is weird to me. I don't love it. This is your hip from the anterior view. You can see the sacroiliac joint. This is where your hip bones interact with your sacrum. This is where, when you walk, your hips wiggle with your back. This large bone is the ilium. The front of it here is the pubis, and this lower arch is called the ischium. The symphysis pubis is a cartilaginous, it is cartilage, little connection that holds them together, and that cartilage allows for some wiggle and some movement. When women are pregnant, or birthing people are pregnant, and this pubic symphysis will actually stretch to allow for the hips to open up for the baby to pass through. Here we have the anterior superior iliac spine. All right, this is the ilium. So this is the iliac spine. It is the spine, it is the ridge and edge of this. And this is the obturator foramen. It is the large hole that your major nerves and such as like your sciatic nerve and other ones pass through to go down the leg of the body. Now, here is an image not from your book that I like quite a bit more. I just wanted to pull it in to show you guys just another view and how the hips articulate with the sacrum, and more importantly with the femur itself. So here we have an anterior view, and we are looking at the iliac fossa. This is the flat, scooped out inside of the hip. All right. This is the iliac crest. Again, we're looking at the iliac crest. This is the anterior superior iliac spine. And way back here, we're looking at the ischial spine. We'll definitely talk about ischial tuberosity. That is a pretty famous palpation point when your patients are laying prone. When you press in with upward towards the head, but also downwards towards the table. So upward and medial pressure on the ischial tuberosity. You can press on a couple of veins and nerves that actually help relax women when they are going through menstruation. It actually helps with menstrual cramps quite a bit, pushing in on the ischial tuberosity. But again, I digress because I get excited about working on people. We can talk about that later for sure. Again, here's that pubic symphysis. This is that cartilage that helps The hips have a little bit of wiggle up here in the front and flexibility and move, because as you step forward with one leg, this twists, but you don't want this necessarily to twist because you want it to stay stable, because this leg is in the swing phase, but this leg is in the standing phase. So this pubic symphysis helps keep things mobile yet stable. All right, this is the ischial tuberosity as it hangs towards the back there. This is what you can palpate. It's also called the sitting bone, very often called the sitting bone. Here's the obturator foramen again from another view. Here is the intratrochanteric line. Okay, we're going to talk about the femur in a minute. This is your thigh bone just below the hips here. This is the femoral head. This is the head of the femur, where it articulates into the hip bone, into its socket. Here's another view of it. I know that we are not deeply studying the ligaments in this chapter, but I did want you to see an overall image of just how stable this entire pelvic girdle is because of the sheer amounts of thick and short ligaments that are here. It's really just glued together every which way to produce stability. And when you see these iliolumbar ligaments, this one I want to bring up in particular for massage as well. This one right here, this iliolumbar ligament. Very often when people start complaining about SI joint pain and they can't move very well and they can't seem to like stretch out of tightness, if you palpate in and feel the indentation where this iliolumbar ligament is, and give them some neuromuscular therapy work or some acupressure work in here on these ligaments, you can stretch these out for them slowly but surely and provide a great amount of low back release. You can see how deeply your lumbar spine goes into the hip here with the ligaments coming up above. This ligament actually attaches from the hip to L4, not necessarily to L5. Again, here's the iliac crest. These are the hip bones. When you put your hands on your hips and you feel your bones sticking out, that is the iliac crest. The inside is the iliac fossa. And when you are laying on your back, when you are laying supine, you are feeling the superior iliac spine lower into the anterior portion of your hip. Now let's keep moving down to the femur. All right, here's the anterior view of the femur. So we would be looking at your client's right femur here, and here is a posterior view of the femur. On the lateral portion of the femur, we have what's called the greater trochanter, right? Here is the neck, and this is the head of the femur. It almost looks like a little mushroom. Yay! So this neck is skinnier and it bulges out into the head. The head of the femur is where it articulates into the hip. It looks like a ball, which this is called a ball and socket joint, which we will be covering in a further chapter. For now, just know that this is the head of the femur and this is the neck of the femur. This great bulge up here is the greater trochanter. As we go down, we see another bulge that's medial. This is the lesser trochanter. This is the intertrochanteric line, okay? The image that we saw before was quite a bit better, but this is the line that was being described before between the trochanters, the intertrochanteric line. It is there. Right here is what we were looking at, right there, that line. All right, going down on the anterior view, you have lateral and medial supracondylar ridges, all right? So these are your condyles down here. So supra is above condylar, it's above your condyles, and these are very prominent ridges when you're looking at an actual femur. You, of course, have the lateral supracondylar ridge and the medial supracondylar ridge. This is your patellar groove right here, and we will discuss your patella in a minute. This is your lateral epicondyle, and this is your lateral condyle. These are your adductor tubercles, and these are your medial epicondyles and your medial condyles. This is your intercondylar fossa. Fossa, so it's an indention again. Inter, it's between. Condylar, the condyles, between the condyles, fossa. Intercondylar fossa. On the posterior view, so we're looking at the back of the leg, you again have medial and lateral supracondylar lines. And you can almost see this looks like a raised little ridge right here. All right. This is called the pectineal line. Here's a hint. You do have a muscle called the pectineus. You have the linea aspera that is right here. You have the gluteal tuberosity sticking out here. Here's another hint. You have gluteal muscles. You have the intertrochanteric crest. It is a crest that is sticking out here between the trochanters, and you have the intertrochanteric fossa. So now we have a groove in between the lesser trochanter and the greater trochanter. Now, I'm going to erase some of my scribbles here so you can see this better. You can see them bulging up a little bit from the anterior view, but look from the back. Look how large these are here. Now, you won't be able to palpate the head of the femur. It is deeply in, but on some of your clients, you will be able to palpate the greater trochanter for sure. All right. So just looking at our little model that we have here, you can see the greater trochanter right here, sticking out right here. All right. And you can see some of those grooves, and you can absolutely see these condyles, especially from the back. You can see these condyles and these attachments for a lot of these large muscles that call for flexion of the knee and extension of the leg. Now here is looking at your leg as a whole. Again, here's the hip. Again, we're looking at the greater trochanter. Now your lower leg, just like your forearm, has two bones. You have the tibia and the fibula, right? Your tibia is the larger bone, and looking at the anterior view, it is the medial bone, and the fibula is a thin, straighter bone that is on the lateral portion of the leg. And here is a little sesamoid bone, all right? This is our patella, and is a sesamoid bone because it is not directly articulating with any other bone. It is completely surrounded by other connective tissue, and it glides into that patellar fossa that we saw on the femur, or the patellar groove that we saw right here is where it slides. Okay. So here is your book's image of the patella. It is nothing to write home about. The apex is on the pointy bottom. Again, the base is actually at the top. This is the anterior surface. So when you tap on your kneecap, this is actually what you're touching right here. If you were to look at the back of your kneecap, you have two facets where it actually slides over into the groove. All right, now we are going to look at the tibia and the fibula from the anterior view. We are looking at your client's right lower leg right now. So this tibia lines up with this bad boy over here. This is your medial malleolus. When you rub the inside of your ankle and feel that big bump on the medial side, that's your medial malleolus. It is this big bump right here. All right. You also have a medial condyle, which is right here. And you have a tibial tuberosity, which sticks out right here. This is your intercondylar eminence. It goes between the condyles up here, and it rises up a little above, not like a process, but we call it the intercondylar eminence. This is your lateral condyle and your medial condyle. So again, intercondylar eminence. This is the head of your fibula, and it does go in gracefully like a neck. This is your neck of the fibula and the head of the fibula. This is your lateral malleolus. All right. When you feel the outside of your ankle and you feel that little knob right at the very base of your bone, at the distal end of your fibula, that is the lateral portion of your ankle. It is called the lateral malleolus. Now that brings us to your feet below your ankle. Again, this is a medial view right here. So we're looking at your tibia and your medial malleolus here, and just your fibula hanging out on the other side of it, out towards the back there. Now, the structure of the ankle is really similar to the structure of the wrist. There are 7 tarsal. They are tarsals, not carpals. In your feet, they are tarsal bones, and there are 7 of those that connect the foot to the leg. The largest tarsal is the calcaneus, or the heel bone. This is what we're talking about right here. This is the calcaneus, or the heel bone. The talus is the major weight-bearing bone of the foot during all upright motions. So it's this guy right here. He's kind of flat. Almost looks like a little hoof in the back. He sits right on top of the calcaneus, and it's squashed between the tibia and the calcaneus. That is your talus. The talus and calcaneus are the most posterior of the tarsal bones, and they articulate anteriorly with the other tarsals. So that means anterior in the front is where all of their articulations with the other bones are. You have the cuboid towards the bottom. You have the cuneiforms in front, and you have the navicular right here in the middle. Just like your hands have metacarpals, you have metatarsals in your foot. All right. Again, just like the carpals and metacarpals, you have 5 metatarsals. All right, that go to each of your 5 toes, just like your 5 metacarpals go to each of your forefingers and thumb. There are 26 total bones in the foot. The rest of these are made up of your distal and proximal and middle phalanges. A single one is called a phalanx. Here is your middle one on your little toe, and your tiny distal one, and your proximal, just like your phalanges in your fingers. It is the same in your toe, and like in your thumb, your great toe only has a proximal and a distal. If you do plantar flexion, you curl your toes forward and you see your toe knuckles. Again, these are the rounded distal ends of your metatarsals. I have a client that liked to ball up their foot and call it a toe punch. You know, you meet lots of people. The last image I have here for you is the arch of your foot. All right. This is the medial longitudinal arch. This is the inside of your foot, the medial side, all right, where your 2 feet face each other. This is what we talk about usually when we're like, do you have a high arch or a low arch? We're talking about the medial longitudinal arch. And this is what, when people say, oh, I'm flat-footed, I have pes planus, which we will absolutely talk about in a later chapter. We are talking about this arch collapsing, maybe some of these muscles in here being atrophied, or being overstretched and not even being able to keep this taut anymore. This is the lateral longitudinal arch. All right. This is not the arch that we are typically referring to when we say, hey, are you flat-footed? Do you have pes planus? Do you have a really high arch? But there are two arches to the bottom of your feet, just like you have a carpal arch inside of your wrist. This is to allow for greater movement and for important innervation to go through. You want your nerves and your blood supply to run through these things freely. Absolutely. And so keeping a healthy arch keeps a healthy open space for those delicate things to run through. Now, your appendicular assignment is pretty much directly out of your textbook for this chapter. I highly recommend you do go back to your textbook and read any extra information that you want. Your general lecture for the week will cover the rest of what is in the chapter, such as various fractures and abnormalities that have to do with the skeletal system. And of course, if you have any questions, you are absolutely free to reach out to me. And I hope you found this helpful.